name's Ryan. This is for my IV push competency. First thing I'm going to do is I'm going to take my MAR and compare it to my physician's orders. First, I'm going to make sure that they match in patient name, medication, dose, time, and route. My patient's name is Janet Green. My medication is furosemide. Be giving 30 milligrams. The time is at 0800 and the route is IV push, which is via the primary line. I'm also going to check to make sure that Ms. Green doesn't have any allergies that conflict with furosemide. I see that she's allergic to penicillin, but that does not conflict with furosemide. I can set that to the side. Now I'm going to come over to my IV drug book. I'm going to be checking a couple of things in here. I'm going to make sure that this is a safe dose. They can receive 20 to 40 milligrams of furosemide IV push. So I'm only giving 30 milligrams, so that is safe. The dilution does not have to be further diluted, so I can draw it directly from the medication here. Compatibility is, I'm just making sure that it is compatible with D5W that is running here. And I can see that it is. Rate of administration. So 30 milligrams needs to be administered over at least 2 minutes, or 1 to 2 minutes. I'm going to administer it over 2 minutes. Any precautions that I may have for furosemide is, of course, I'm checking for renal function, but mainly I'm checking for potassium. Because furosemide does excrete potassium, I'm going to check potassium levels, check heart rate, make sure he has no arrhythmias, she has no arrhythmias or anything before administering this medication. Once I've done that, I can come over and prepare my medication. I have checked to make sure that this is the right medication for the correct patient once already. Preparing my medication and my equipment. I'm going to perform hand hygiene. I'm going to make sure I have alcohol pads, syringe, a blunt needle, and of course my label and my medication, which at this time I'm going to check to make sure is not expired. And I'm also checking to make sure it is furosemide, which does match my MAR. So this is the second time I'll be checking to make sure that I'm giving the right medication to the right patient. Again, it is 10 milligrams per milliliter. So in this case, I will be pulling up 3 milliliters to administer, and that will be 3 milliliters over 2 minutes that I'll be giving IV push. I will not have to use any flushes because it is already being flushed through my primary, which is very convenient. Before I do that, I'm going to scrub the top of my furosemide for 15 to 30 seconds. Now, I'm ready. Needle out. I'm going to draw up 3 milliliters of air. Inject 3 milliliters of air and pull back 3 milliliters of furosemide. Going to make sure that there are no bubbles. I'm going to recap my syringe. And as you can see, that is 3 milliliters. I have.
Let me see it again. It wasn't.
I'm going to take my label, and of course my label will have patient name, Janet Green, the drug, furosemide, amount, 30 milligrams, the date prepared, my name. Going to put that label on my syringe. Going to bring my antiseptic swab. And this time I'm ready to enter the patient's room. Hello, Mr. Patient. My name's Ryan. I'll introduce myself. First thing I'm going to do is get the patient's name and date of birth. I'm going to make sure that this is the right patient. I'm going to get 2 identifiers, one the wristband and one verbal identifier. And I'm going to make sure that this is the name that matches on my MAR, which hopefully they'll say they're Miss Green, and that's the correct name and date of birth. And this will be the 3rd time I've checked to make sure that I have the correct patient for the correct medication. I am once again going to perform hand hygiene. I'm going to ask Ms. Green if she has any allergies that might conflict with this medication. She says she's allergic to penicillin, which that does not conflict with furosemide. I'm going to tell her that I'm giving her furosemide to hopefully get rid of some of the fluid that she has. So let her know that she might be urinating a lot or urinating frequently. I will be administering this medication via the hub closest to the IV site. And I'm also going to tell her that. I'm not going to have to stick her again or anything like that. I'm going to be using the primary line. I'm going to assess the site, make sure there's no redness, edema, or swelling. Check for patency by lowering the primary IV below the site. Check for blood return. It is patent. At this time, I'm going to go ahead and scrub the hub. To 15 seconds. I've done that. Take off my filtered needle, attach it to my hub, and this is what we call the pinch release method. So basically what I'm going to be doing to flush the line is I'm going to pinch the primary, administer, release, pinch, release, administer, pinch, release, administer. I'm going to be doing this over 2 minutes. 2 minutes, 3 milliliters over 2 minutes, so that is 1.5 milliliters per minute. Here we go, I'm going to pinch, administer, release, flush it, pinch, administer, release, flush it, pinch, administer, release, let it flush. This time it's been a minute. I can go ahead and ask my patient if he's feeling any discomfort, anything at the IV site, any pain. Pinch, administer, release, pinch, administer, release, pinch, administer, release, pinch, administer, release. So I've done this. Going to take both of these and dispose of them in the sharps container way over there. I'm going to once again ask the patient if he has any discomfort, anything I can get for the patient before I leave the room. I am then going to go and document this procedure, of course, wash my hands before leaving the room.